A very good evening to everyone. This is Batul, the moderator for today's session from IGCP, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned ophthalmologist, who is none other than Dr. Quresh B. Muscati, sir. Sir needs no introduction at our platform, but yet it's our pleasure and honor to introduce him. He is MBBS, MS, DOMS, FCPS, FICS, consultant ophthalmologist at Muscati Eye Clinic, Mumbai. With Sir's wonderful insights, we are going to talk about the topic for today, which is how to maintain healthy vision on this month of healthy vision. Before moving on to the topic, let us have a brief look on what the topic says. So, in this session, we will be providing valuable insights into practices and habits that support eye health, along with the latest research and recommendations for preserving vision throughout life. Now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. Sir, over to you.
Thank you, Batul. This is a Healthy Vision Month, and you've chosen a very topical subject to speak on. Many people go to Google and the internet all the time looking for the latest advances in cataract surgery and in medicine and surgery. But it's been said by our ancients, by our buzurgs, that a stitch in time saves nine, and prevention is better than cure. So why wait till your eye gets diseased? Can we do things to preserve our eyes, to preserve our vision as much as possible? Everything is not in our control. Age is not something that we can overcome. All of us who are born today have to die tomorrow. But in between, can we remain healthy? If our lifestyle is healthy, chances are that our vision will also be healthy. Let's share a few tips. Let's start from birth and then go on to old age in the next few slides. Next slide, Batul. Yeah. So first thing is, when a child is born, send the child to the eye surgeon immediately if the eye appears larger than normal. It may be congenital glaucoma. See the third picture that you can see, that where the right eye is appearing larger than the left eye, because the cornea, the front portion of the eye, the black portion in front of that is a transparent glass called the cornea, just like the glass in front of your watch. So when the tissues are not fully formed and the pressure in the eye is high, then that cornea will balloon forward, will bulge forward, and make the eye also appear to be larger than the other. So especially if there is only one eye which is affected, then you get a larger than normal eye. This is called buphtalmos. Buphtalmos means bull's eye, because a bull's eye is larger than a human eye. So it's descriptively called as a bull's eye. You can have unilateral buphtalmos or bilateral buphtalmos. So these are things which need to be corrected immediately. The doctor will take the patient up under general anesthesia, check the pressure, check the nerve of the eye, and decide whether to start medical treatment, which is unlikely, or go in for early surgery. We can even do surgery a week after birth. The second thing that you can see, again, you don't need an eye doctor to see this. Just as a layperson, the eye appears big, send the patient to an eye doctor. If there is a yellow or a white glow in the pupil, as you can see in the middle picture, again in the right eye, the left eye pupil is black. The right eye, there's a yellow or white glow in the pupil. There are umpteen causes, 18, 20 different causes for a yellow glow in the pupil. But the commonest is a tumor called retinoblastoma, a tumor arising from the retina. And again, this needs to be examined under general anesthesia. More important than this eye, the other eye is with dilated pupils examined to see if there is any hint of retinoblastoma in the other eye, because 1/3 of these cases are bilateral. And if there is an early retinoblastoma in the good eye, then that can be lasered, sealed. It can be a cryopexy can be done, chemotherapy can be done. While in the eye in which the retinoblastoma is already staring at you through that white or yellow glow, we may even have to remove this eye at the age of 1 week after birth. The other causes, there are many. Some are harmless causes of yellow glow. So don't get disheartened, don't get panicky, but they require to be seen by the eye doctor. Another cause which is not to be panicked about is a congenital cataract. As you can see in the first picture, the pupil is widely dilated. The brown rim that you can see is the iris, which is dilated. And you can see in the center that white glow is the cataract surrounded by grayish glow, which is an immature or not mature. So central area is very white and the periphery is not so white. So there are various types of congenital cataract. Can be a zonular cataract, can be a fully mature cataract. So the eye surgeon will know what to deal with. Not all congenital cataracts require immediate treatment. If we can wait, if we can allow light to go in by just dilating the pupil, we may wait till the child is 1 year of age, because if after that we can do the surgery and put a lens implant in the eye. Usually before the age of 1 year, we cannot put a lens implant. So if we have to operate a cataract which is in one eye, we will do it and leave the child what is called aphakic without putting a lens implant, and put contact lenses on the child so that he can see through that eye. And when the child is 1 year or more, we may do a second surgery and put a lens implant in the eye. So we are not here to discuss all the treatment options. I'm just trying to say how a stitch in time can save nine, how prevention is better than cure. So these are some of the congenital conditions, or very early in childhood, if you see eye appearing larger, white or yellow glow, send the patient to the eye doctor. Next. So what if nothing of that sort is present? Both eyes are normal in size. There is no yellow glow. Even then, a routine eye checkup by an eye surgeon at the age of 3 years is mandatory. In the US, every school is told, every parent is drilled, the pediatrician, the child specialist sends the child for the first examination by an eye surgeon when he's 3 years old. You will ask me, why 3 years? My child cannot read ABCD. It doesn't matter. I don't need the child's cooperation. I can do tests and find out if there is a refractive error. Does he have plus number, minus number? I can prescribe glasses at that age, which the child will wear. Even if the child has got, cannot read ABCD or any language, it doesn't matter. So we can determine, why is it important? Because if nowadays in school work starts early, then they are sitting on computers at the age of 3, they've got a blackboard there. So if the child can't see the blackboard, the child stops answering questions in class, he doesn't do well in his studies, and he gets an inferiority complex. More importantly, if the child has a refractive error in only one eye, then that eye can become amblyopic or lazy. And then if we detect it later, we detect, the more aggressive the management we have to do with patching of the good eye, stimulation of the lazy eye. And the older the child gets, the more difficult it is to restore the vision of the child. The third thing we see when the child is at 3 years and comes, is there any squint? Is one eye looking inwards, or one eye looking outwards, or both eyes looking inwards or outwards? At that age, if we see it, we can correct it at an early age. If the child is looking inwards, it's called a convergent squint. Some of these convergent squints are due to plus numbers. We check the number and we give the correct glasses and the squint disappears. If the eyes are looking outwards, that's called a divergent squint. It is not due to spectacles. We need to operate these children early to restore binocular vision and to prevent the child from getting an inferiority complex. So again, just imagine a child with a squint corrected at the age of 3 years or 4 years of age and restored normalcy, has perfect binocular vision, no inferiority complex, can become a Bill Gates tomorrow. While a child whom the parents have neglected, saying that a squint is a gift from God, or they've heard somewhere that squint comes back after some time, there's no use operating. All these myths go around when you ask neighbors and friends, and don't talk to the eye surgeon. And that patient, that child at the age of 18 goes for correction. By that time, it is too late. I can cosmetically correct it, but his inferiority complex has already come in, and I cannot restore binocular vision. So again, a stitch in time, every child to see the eye surgeon by the age of 3 years. What about myopes? So suppose you send the child to me at the age of 3 years, and I find that the child has got a minus number. Nowadays, with more and more near work that we do, that children are exposed to Even as part of their school work, they have to sit on the computer or do a lot of reading work. And for their spare time, they're playing video games or they're watching TV or mobile phones. So they spend less time outdoors. So myopia is a galloping pandemic. It is like COVID. It is hitting us. Previously, just 15 years ago, less than 5% of children in the class were myopic or wearing minus numbers. Now almost 25% or more are wearing minus numbers by the age of 8 or 10 years. Why is so? Why is this so? Because we are spending much less time outdoors. It is recommended that every child, more so myopes, must spend a minimum 2 hours a day outdoors in sunlight. Somehow sunlight, we don't know how, is a good antidote for myopia progression. In China, they said, let's mimic sunlight. So they increased by 100 times the amount of light in the room, artificial light, to see whether they could prevent myopia from progressing. They failed. So it's the sunlight which is important. So spending more time outdoors. In Australia, there are some schools which prescribe minimum 2 hours a day break during school hours where the children play sports in the sunlight. And Australia has lots of sunlight like India. So more time outdoors. They must spend minimum time in near work. So I tell parents that whatever school work which necessitates reading or the mobile or the computer or the iPad, do it, but not for pleasure. So spend minimum time in near work. The third thing I stress is a healthy diet. This is for myopes, especially important. Less junk food and more home food, whether you're vegetarian, non-vegetarian, vegan, it doesn't matter, but have what is cooked in the house because that is healthy. Eating burgers and pizzas every day from outside is unhealthy and promotes myopia progression. That has been seen in several studies. So good green leafy vegetables, fruits of all types are healthy. Milk is healthy if you're allowed this. And if you're a non-vegetarian, then meat and eggs is also healthy. So a healthy diet means whatever is cooked in the house. You don't have to convert from veg to non-veg or vice versa. Just whatever your parents cook for you is fine. And if a child has myopia which is progressing in spite of spending time outdoors and less time indoors and with a healthy diet, then we as eye surgeons prescribe what is called myopia control measures like low dose atropine drops at night, and there are special myopia control spectacles and contact lenses which can prevent the myopia from progressing. So all this would be discussed with your eye surgeon. Today our idea is to just give you a bird's eye view of all that is possible for us to lead a healthy lifestyle and maintain our vision and prevent again myopia from galloping. In children, there are some relatively harmless conditions. You see this silvery white appearance on the conjunctiva. These are called Bitot spots, and these are due to vitamin A deficiency. So this can be treated by a family physician with intramuscular and oral vitamin A supplements. And if the community, if you're practicing in an area with low income and their food is not rich in vitamin A, you can treat the entire community. All the children in the community can be given vitamin A supplementation. It costs practically nothing. You just have to break an ampule of vitamin A injection and pour it in through the mouth because it's a water soluble, fat soluble vitamin. So you can treat this. You can give intramuscular injections as well. Let me come back to prevention. So what about excessive screen time? Is it harmful for adults? Is it harmful for children? Yes, it is harmful for everybody. But you'll say that I am a software programmer. My job entails sitting 14 hours a day on the computer, on the laptop. Doc, how can you say that screen time is harmful? How can I prevent it? Can I put some special screens on the computer? Can I wear blue blocking glasses as my optician tells me? Rubbish. So there is no special screens on the computer. They don't help. They're commercial marketing gimmicks. There is no blue blocking glasses which help. These are commercial marketing gimmicks. So important thing is, if you're an adult and you have to sit on the computer for long hours, make sure that your posture is correct. Have a lower back support. Sit upright like this, and your screen should be lower than your eye level. at eye level or lower than eye level. So at least 1/3 lower, it must form a 30-degree angle from your eyes to the screen. You should not be looking up like this at the screen, because then your neck gets and back gets into problems, and you'll end up with orthopedic surgeons and unnecessary treatment and physiotherapy and all sorts of things. So one is correct posture, keep the computer below your eye level. Second thing is, remember, God created our blink action for a reason. We blink about 25 to 30 times a minute. Every couple of seconds we blink when we are not on the screen. But when we are on the screen, our blink rate drops by 50% or more, because subconsciously we are so afraid that we will miss out on what we are seeing on the screen, that we stare at the screen. More so computer programmers and those who are sitting on the computer for long hours. Even when we blink, our blinks are half blinks, incomplete blinks. So the eyes remain open longer time, and our tears, which are supposed to lubricate our eye 24 hours a day, our poor tear glands situated under the eyebrows on the outer side are sending tears through pipelines into the eye. But when we don't blink, when we blink, the tears move across the eye like a windscreen wiper and clean and lubricate the whole eye. When we don't blink often, the tears remain in pockets. So there are pockets where there is wetness, but the tears haven't moved that side. The inner side is dry. So you can have water coming out from the eye and still your eye is dry. So you need to blink more often, and every 20 minutes or so, there is a remedy called the 20-20 or the 20-20-20 rule. That means every 20 minutes, you either close your eyes for 20 seconds or look at an object 20 feet away from you. But easiest thing to do is just close your eyes for 20 seconds. You don't have to go by stopwatch. Every 20 minutes means you can do every half an hour. Close your eyes for about half a minute or minute. That gives your eyes the tears time to spread evenly under the closed eyes. If you're sitting in an air-conditioned room, remember the air conditioning, at least in big cities like in Mumbai where I am, from my room, the air conditioning, it's a split unit AC. It has a pipeline which the air conditioning pulls the water out from the room and by a pipeline drops it on my neighbor's balcony. So the room doesn't like to be without water. So it sucks the water out from your eye, which is staring open. So your eye becomes more dry because of air conditioning. So if you're forced to sit in an air conditioned room, sit with the air condition behind you, not blasting in front of you. So everybody, a child or an adult, excessive screen time is harmful. Do whatever you need to for your work, but take breaks frequently is the take-home message to keep your eyes healthy. What about an adult? We talk so much about children and refractive errors and myopia and screen time. I am an adult. I have reached the age of 40. I have no symptoms. My eyes are perfect. Why should I come to you, doctor? That's what my patients tell me. So if no symptoms, even then, your first visit, at least at the age of 40 years, you must visit a doctor. Why so, eye doctor? Because the eye surgeon can check your eye pressure. Glaucoma usually starts up by the age of 40 or more. So you can check the pressure of your eye. You can look inside your eye. If you see the pictures below, that yellow light, you can see my ophthalmoscope is looking inside the eye, at the back of the eye where the retina is. In the old days of film cameras, the film was at the back of the eye. Similarly, our retina is at the back of the eye. So I can look. That's the only part of only an ophthalmologist can look at a part of the brain. No other specialty can see it, because the eye is connected by a nerve called the optic nerve, which goes right up to the brain. And by looking inside with an instrument called an ophthalmoscope, I can see how healthy your nerve is. So I can look for signs of glaucoma. Then we have a machine called a slit lamp microscope, by which I can check for dryness of the eye. Because of all the problems of computers and pollution, more and more young people are developing dryness of the eye. So I can diagnose that. I can look for early cataract. Patients nowadays, because of pollution and unhealthy diets, are developing cataracts early. Previously, never before 60. Now we are getting cataracts as early as 40 years. All this can only be detected by me, not by an optometrist sitting in an optical outlet. And Of course, at around the age of 40 in India, you may start requiring reading glasses. You start holding objects further and further away from you to read. So that's a sign that you require reading glasses, which I can prescribe to you. Also, if you are a diabetic, or if you are hypertensive, you have blood pressure issues, or you have thyroid problems, as soon as any doctor has detected it, even at 30 or 35, if you are detected to have blood pressure problems or a thyroid problems, you must go to the eye doctor when detected for baseline examination, and then as directed by the eye surgeon, because we can look inside and see whether there are any changes, and then once a year I can follow up, and the earliest signs of changes I can alert your physician that in spite of your blood pressure control, his eye is showing deterioration because of blood pressure. So please bring the blood pressure down further, or bring the diabetes down further. So we work together with the physicians because we can see inside the eye. So why should I come, doctor, to you? Because you charge so much money. Why don't I go to an optical shop? You know, the nearest optical shop, he gives me free checkup, free eye checkup, yeah, whether or not I buy spectacles from. So much cheaper. You doctors are luteras. You doctors are looting us. Why should we come to an eye doctor? Why not visit an optical shop, or just go online and check my eyes? Good question. The answer is, a complete eye examination is not possible in an optical outlet or online in India. The eye pressure cannot be checked by them in most of the optical outlets, and they are not authorized to dilate your pupil with drops and examine the retina and optic nerve. So that's not possible, and certainly online no one can do this. So early glaucoma, cataract, dry eye that I talked to you, and if you're older, macular degenerations. Macula is the central portion of your retina, and that can degenerate again because of poor diet or because of genetic causes. And these are missed unless you visit an ophthalmologist. Many a time I get a patient who's 40, 45 walks in. I ask him any history of diabetes, blood pressure, thyroid. No, doctor, I'm perfectly fit and healthy. Then I dilate his pupil and I examine the eye and I find changes of diabetes. And I tell him, you're diabetic. He says, no, doctor, I'm not. When did you check it? Doctor, I've never checked it, but I'm healthy. I have no problem. Then I ask them to get the blood sugar checked and it is 300. Or I ask them to get the blood pressure checked, which I do in my clinic, and it is 200 by 120 blood pressure. So many times the eye surgeon is the first one to detect diabetes and blood pressure during a fundus. Fundus means retina examination. So that is why you should not go to an optometrist, but go to an eye surgeon when you're 40. What about after 40? Yes, after 40, every year, at least once a year, you must go to an eye surgeon for an annual examination by an ophthalmologist. Why? Because he can monitor the progress of the cataract. Not that I'm saying that I will operate you just because I detect a cataract. Mount Everest is there, but all of us don't go to climb it. Similarly, even if I detect a cataract, till it disturbs your day-to-day functioning, I'm not going to operate. So beware of an eye surgeon who detects a cataract and says, I must operate your cataract tomorrow, otherwise it will be too late. Zyada pak jayega. That's rubbish. You must get your cataract operated when it disturbs your day-to-day functioning. If you are a very rich man who has to sign million-rupee checks every day and your signature differs because you can't see the signature well, maybe you need operation tomorrow. If you are a champion golfer or an Olympic archer and you have to see the target perfectly, and that your golf game is dropping or your archery is going down, yes, then I might operate you tomorrow. But by and large, for 99.9% of our population who are not archers or champion shooters or $1 million millionaires, you operate the cataract when it disturbs your day-to-day function. If you're driving and you find that driving is causing a problem, or if you're a taxi driver and find that you can't drive at night, so your earning is affected. So these are the indications that we will, or you find that you're losing your confidence in crossing the road, or you find that you're a daily wage laborer and sunlight bothers you. So some of these things, if it affects your day-to-day functioning, only then will I operate you. So annual exam, I can also, every time that you come, I check your eye pressure, I check for changes in your retina, in your nerve of the eye for glaucoma, because glaucoma is a one-way street. What vision you lose in glaucoma can never come back. Cataract, even if I operate you after 5 years, whatever vision you have lost in these 5 years will come back once I operate and put a lens implant. And again, I stress, I can pick up early changes of diabetes and blood pressure in the retina, even though your vision is normal and you have no other symptoms. So these are just some of the pictures. This is early diabetic retinopathy. Retinopathy means changes in the retina. You see that central yellow disc, that's the optic nerve, which is healthy. But just below that, you see a red spot where the blood vessels are. That's a small hemorrhage there. And you see a couple of yellow spots below that. So those are cotton wool spots or exudates. So this is early diabetic retinopathy. This patient had 6/6 vision. He was absolutely normal. I examined him and told him you have diabetes. The middle picture is of papilledema. Papilledema is a swelling in the nerve of the eye. You see the first picture, that normal yellowish pink nerve, and you see how red this nerve is, and it's the edges of the nerve cannot be seen, and you see blood vessels, the dilated blood vessels and splinter hemorrhages all around the nerve. So that's papilledema or edema of the optic nerve, which could be because of a tumor in the brain. So just looking at your eye, I can detect that you could be having a tumor and ask you to see a neurologist or get a CT or MRI done. If I don't do this and the papilledema remains undetected, the nerve becomes slowly dies down and you get a disc pallor or whiteness of the nerve, and then it is too late to restore vision, and the tumor in the brain may have progressed also. So annual checkup helps us to pick up these. And the picture below is of hypertensive retinopathy, where the changes due to blood pressure. We won't go into the details. You get exudates, cholesterol deposits, blood clots. Those red spots that you see are blood clots. The yellow spots that you see are what you call hard exudates. And even the blood vessels show what is called silver wiring. That means they become thin and hard because of the cholesterol deposits there. Let's go again. I want to keep coming back to the fact about prevention. Sleep and eye health. Adequate sleep is very important for the eye to produce healthy tears. We should reduce eye stimulation at least an hour prior to retiring. So stop TV, use of cell phones and bright lights at least an hour prior to going to bed. We need a substance called melatonin, which is produced by the body for sleep. If you stimulate your eyes so much, the amount of melatonin goes down and your sleep is reduced. Not only does the eye health suffer, but your general health suffers. What about diet and eye health? I mentioned this, that several studies have shown that excessive junk foods can lead to progressive myopia in children, early onset and worsening of age-related macular degeneration, and poor quality tear production, so dryness. So have a balanced diet, fresh fruits and vegetables, home diet, home food as much as possible. Lastly, can cataract be prevented? This is something I'm often asked. Doctor, your cataract surgery is so expensive. Can we not prevent it by some magic drops? No, unfortunately. No special diet, no drops, no urine therapy, traditional medicines, homeopathy. Nothing can prevent a cataract from progressing. It may stop progressing on its own. We don't know why certain cataracts continue to progress and certain don't. When to operate, I told you, only when it interferes with your usual lifestyle, not when your eye doctor diagnoses it. And which method of surgery is better? This is not the forum to discuss this, so leave it to your operating surgeon. There are methods called SICS, phacoemulsification, and laser-assisted cataract surgery. There is no laser which does a cataract surgery, no robots which do cataract surgery. These are all marketing gimmicks. And which IOL to insert, a monofocal, multifocal. Discuss all this and your lifestyle with your eye doctor, and not all patients will benefit from multifocal. So all this we are not discussing today. Main accent is on prevention and how to maintain a healthy lifestyle. There is age-related macular degeneration of two types: dry, which you can see in the picture above, where you get these cholesterol deposits around the macula. Good thing is that it's very slowly progressive and does not cause blindness, but no treatment is available. So we prescribe antioxidant tablets. And there is a wet type where you get waterlogging in the retina. The middle black and white picture is showing that like a hill where water is there. That's an OCT image which shows waterlogging of the macula. and it's treated with various injections in the jelly of the eye called intravitreal injections, which may need to give repeatedly to improve or to maintain vision. So if your doctor tells you this, he's not trying to make money. This is genuine. Thank you so much for your attention. And I hope I could stress to you prevention is better than cure, and an annual eye checkup is all that you need to maintain healthy vision. Thank you so much. Over to you, Batul. You can stop the screen share.
Thank you so much, sir. Thank you for your overwhelming talk about the topic that you have shared today with us and for making our viewers understand about it in such a better manner. Thank you so much for that. Moving ahead with the question and answers round, so we have received few questions from the participants. So, with all your due permission, I would like to put across those questions to you.
Sure.
So, the first question is related to the most common eye conditions affecting adults and children, and what are the primary risk factors for these conditions?
So the most common eye conditions affecting children are refractive errors if we don't count trauma. So if we don't count trauma, then refractive errors are the most common eye condition. And we've discussed that trauma is something which, out of lack of time, I didn't talk about. We need to have safety measures when children are playing and keep scissors and sharp objects away from children. Mothers should, if they're working in the kitchen and a small child is there, they should see that knives and other things are kept at a height so the child cannot get to it. In adults, the commonest is cataract and age-related macular degeneration, both of which we did discuss during the talk. Thank you.
Thank you so much, sir. Thank you for answering that question. Moving ahead with another question that we have received, and the question is related to the symptoms. So, what are the symptoms and causes of digital eye strain, and what recommendations can be made to patients for preventing it?
Very good question. Digital eye strain is something that we are seeing more and more, and the patients feel tired at the end of the day. They come home after a full day's work on the computer. They don't want to read, they don't want to watch TV. They just want to close their eyes. They feel better when they're closing their eyes. They might get a sensation of dryness, itching sometimes, foreign body sensation as if some sand particle has gone in because of the dryness in the eye. 15% of them will actually get watering from the eye because some parts of the eye are dry and some are wet. So don't be misled by watering from the eye. That's again a symptom of digital eye strain. But digital eye strain is part of the general body affection because of overuse of the computer. So as I mentioned, maintaining a correct posture, sitting upright with a low backrest, with your screen at 15 degrees or 30 degrees below you for a laptop or a desktop. These are things which you can use. And the 20-20 rule that I mentioned, close your eyes for at least 20 seconds every 20 minutes or so. Thank you.
Thank you so much, sir. Thank you for answering that question. Moving ahead with another question, and the next question is related to the best practices for educating patients. So, what are the best practices for educating patients about maintaining healthy vision and encouraging adherence to preventive measures?
So, because of modern technology now, in the old days, we used to have pamphlets which we used to keep in the waiting room for the patients to read. But most patients don't pick up and don't read. Now we have TVs in the waiting room where we continuously show all these things that I talked about today about healthy life, maintaining healthy lifestyles. And we have QR codes which we give. I have a standee in my clinic with a QR code, and I encourage patients to click on that QR code so that they get all the tips on their phone, because like it or not, nobody reads paper anymore. They're all on their phones and on their apps. So we keep up with the Gen Next, as we call, and try and disseminate as much information as possible. Important thing is, take the information which your eye doctor gives you. Don't go on to Google and the internet, because all sorts of rubbish is also there. And I've seen patients putting urine therapy in their eyes just because somebody on the net advised that that is the best thing to do morning and evening. Thank you.
Thank you so much, sir. Thank you for answering that question and all the other questions for our viewers. That was the last question for today's session. And I would like to thank all our viewers for their ardent participation that they have shown by staying tuned with us throughout the session and putting across such interesting questions to us. I would also like to thank you, sir, for taking out your valuable time and for being here at our platform and sharing such wonderful insights on this month of health vision that we are actually about to complete in 2 more days. So thank you so much for that, sir. Any last take home message from your end before we conclude?
No, as I've been saying all through, Don't get misled by the information overload that you get on the internet. Trust your eye doctor to give you authentic information. Don't be in a rush to do things. Prevention is better. Just some not doing things, like not spending excessive time on TV, spending time more outdoors, having a healthy lifestyle, healthy diet, adequate sleep, are things which we take, which we neglect, and these are things which are so important for eye and body health. So look after your body, look after your eyes, and they will serve you well till you're 100. Thank you.
Thank you so much. So, thank you for such a remarkable take home message from your end. With this, we would like to conclude the session here for today. Until next time. See you all in the next session. Thank you.
Thank you.